It's the chance of a lifetime, a chance to prevent getting cancer. Dr. Larissa Schwartzman has prepared a path to prevention, which she's offered to share with us today. Dr. Schwartzman specializes in hematology and oncology at Metro Health. So welcome to the show.
Thank you.
And you provided us a checklist of ways to reduce cancer risk. And the very first one actually kind of surprised me, is have a good relationship with your primary care physician. Why is that?
They are our first line of defense, so to speak, because they are hopefully somebody who you will have a long relationship with. They're going to know you very well and know your health well, and they will be the first to notice any changes and prompt you to do any testing if necessary.
Okay, and that's one of the other points there is your main doctor probably is going to be one who's keeping you on track with those age-appropriate screenings. So why are those so important?
Well, absolutely. We oncologists have certain national guidelines that we follow, and primary care physicians are aware of them, and they do follow them as well, and they are aware that when certain tests need to be done, such as mammograms, PSA screening for prostate cancer, colonoscopies, etc., at what age and how frequently they need to be done.
And how early, maybe, if you've got something specific going on.
Absolutely,
so,
yeah.
And one of the things your primary care doctor is going to ask you about is your family medical history. Why does that impact this so much?
That is very important for us because having a family member with a certain cancer could potentially mean that you are at a higher risk to develop the same cancer or maybe at an earlier age. So these things are important because they guide how early you need to be screened, or maybe if you need to be screened more frequently.
And the doctor needs to know if they've had cancer and also what kind of cancer, correct?
Yes, because we frequently see patients who tell us, oh, yeah, I have a family member who's had cancer, but they are not aware of what kind of cancer, and that really makes a difference because certain cancers we know tend to run in families, or there could be some genetic predispositions. So what kind of cancer your family member has had is important.
And I bet this note comes as no surprise to me or to our viewers that having a healthy lifestyle is important, including no smoking.
Yes, everybody's aware of this, but we frequently hear from people, well, we know that people who don't smoke, they also develop cancers, and that is true, but we know that smoking puts you at a very high risk to develop lung cancer, and most of our lung cancer patients have been smokers or are smokers.
Okay.
So, yeah, people should stop smoking, and that reduces their risk of developing a cancer.
All right. How about alcohol? Is it a no-no also on your list?
Well, everything in moderation. So a glass of wine with dinner or champagne at a birthday party is perfectly acceptable, and most people do that. But drinking a lot, meaning a couple of beers each day, or more than that, that really puts you also at a risk for different cancers. So we would like to discourage people from doing that.
Yeah, it's all the good stuff we can't do.
Yeah.
But how about eating, our diet?
Okay, well, that's common sense too. So, high fiber diet we know is preventative when it comes to certain cancers like colon cancer. So, fruits, vegetables, whole grains, we should increase those in our diet.
Is obesity itself a risk for cancer?
We know that it's associated with certain cancers like breast cancer. So, maintaining healthy weight and
and healthy weight that goes along with exercise, which is always what
so we cannot avoid it. So,
it's got to be exercise too. Yes. So fighting off cancer doing these things is a lot better way than trying to fight it off once you have it.
Yeah, so not only do you want to prevent cancer, but if you do, unfortunately, if you do develop it, it's much easier to treat somebody who is otherwise healthy, who can tolerate the treatments that we sometimes have to put our patients through, whether it's surgery, chemo, or radiation. So
good advice.
Yeah.
When it comes to preventing cancer, a healthy lifestyle really helps, and you can tip the odds in your favor by following Dr. Schwartzman's advice. For more help, use the information that's coming up next. My thanks to Dr. Schwartzman.
Thank you.
Thanks.
To learn more, call Metro Health at 216-778-7800 or log on to www.metrohealth.org. Next, so many reasons to smile.